Good afternoon. This is Micah with Healthy Mothers, Healthy Babies. Thank you so much for joining our webinar this afternoon. I'm going to get started in just 1 minute. I'm watching the toll of attendees rise, so I'll give you all a few moments to join us virtually and get settled. Great. Well, thank you again for joining our webinar, Breastfeeding Accommodations in the Workplace. We have some great presenters this afternoon, and it's really a topic that we're passionate about, breastfeeding, and we want to make sure our mothers feel accommodated throughout the state, and really excited for this webinar. So as you may know, Healthy Mothers, Healthy Babies, we're doing this in collaboration with the Georgia Perinatal Association. And so if this is your first webinar with us and you want more topics like this, or you're interested in the work that we do, feel free to visit our website or sign up for a newsletter so that you can get future information about our webinars and our events. And Healthy Mothers, Healthy Babies, we are a nonprofit dedicated to improving maternal infant health, if you're unaware. And we do that through advocacy, education, and access to vital resources. We operate the maternal child health line for the state. We are at the Capitol now while it's in session. And we have a number of programs throughout the state that support education, prenatal education, postpartum education for women. And so this falls very nicely in line with the work that we do. This year, just as a plug, we will have our 46th annual meeting and conference. Registration is already open for that, and that's October 26th to the 28th. We've extended it to 3 days this year, and really interesting topic this year around future directions in maternal infant health technologies. So we'll be kind of intersecting the maternal child health world with the tech world, and I think you all will really enjoy it. So if you're not registered or if you have any interest, please visit our website, and it's listed under events, and you can learn more. And soon we will have our speakers and keynotes posted there as well. And just a plug for GPA, for Georgia Perinatal Association. Their annual conference will be September 23rd through the 25th at the beautiful King and Prince Resort, and that's in St. Simons. And you can visit their website at georgiaperinatal.org for more information. Great. And so as we transition into our speakers, our first presenter is Claire Eden. And Claire's been supporting breastfeeding families for over 20 years through La Leche League as a La Leche League leader, and has been an international board certified lactation consultant since 2009. Which reminds me, I'm so sorry. There will be one nursing CE available through watching this webinar. You must watch it till the end. We can certainly see how long each attendee has stayed tuned for the webinar, so please be mindful of that. And there will also be one CERT available for the CE as well. So post webinar, you will receive a survey link within a day or two with the evaluation, as well as if you're interested in the CERT, there's also a post test. So my apologies, I forgot to mention that at the beginning, but I will also mention it again at the end. But back to Claire, she is an IBCLC. She's been that since 2009. She's among the first lactation consultants to be licensed in Georgia. She currently serves as the director of EPIC, which is the Educating Physicians and Practices in Their Communities breastfeeding program at the American Academy of Pediatrics Georgia chapter. Claire has served on the board of directors of several breastfeeding and maternal child health organizations in Georgia, including the Georgia Breastfeeding Coalition. She has had varied careers in lactation, working at pediatric practice, in private practice, and at the Children's Healthcare of Atlanta. In addition to the Georgia chapter AAP, she and her husband are the proud parents of 3 daughters, and her family has enjoyed putting down roots in the Atlanta area for 20 years. So I will let Claire take it from there, and our next presenter will transition after that. So there you go, Claire.
Great. Thank you so much. Can everyone hear me all right?
We can hear you, Claire.
Great.
Yep.
Okay. Well, I will get going. I wanted to first tell you all a little bit about the Georgia Breastfeeding Coalition. Our mission is to improve and maintain the health of Georgia's families by protecting, promoting, and supporting breastfeeding. Later on in my presentation, which is it's fairly short, I'll show you some about our website, but you can find us at georgiabreastfeedingcoalition.org. And if you're not already on our mailing list, you can sign up there by scrolling down on the home page to sign up for our mailing list. It's free to find out about breastfeeding related events and news in Georgia. So it's a great place to get connected. So check that out. We have been, I'm not able to move the slides. Oh, there we go. We have been hard at work on the issue of workplace accommodations with the Georgia Breastfeeding Coalition since about 2011, when we were awarded a grant to train the trainers in communities across Georgia on how to make the business case for breastfeeding. This effort was led by Mary Jackson and Arlene Toole and involved many leaders in local breastfeeding coalitions and other breastfeeding supporters across the state. We got further support in 2013 to present directly to business leaders across the state, including exhibiting at the state meeting of the Society for Human Resource Managers, which is often called SHRM, when they met in Atlanta. So I wanted to just spend a few minutes with you all today talking about what is a business case for breastfeeding. And it was a program designed by the U.S. Department of Health and Human Services to educate employers about the value of supporting breastfeeding employees in the workplace. The program highlights how such support contributes to the success of an entire business. And the business case for breastfeeding offers tools to help employers provide work-safe lactation support and privacy for breastfeeding mothers to express milk. The program also offers guidance to employees on breastfeeding and working. The resources included in the toolkit help lactation specialists and other health professionals like you all to educate employers in their communities. And the Breastfeeding Coalition has copies of this toolkit available as a resource to those who are doing this work in their community. And I'm very happy to mail you or meet up with you to deliver a copy of the toolkit. And there'll be an opportunity. I'll review that at the end of my presentation, how to get in touch with us. So, Sarah is going to speak more to the current laws and status of accommodation in Georgia today and in the U.S., but I'm going to be reviewing the work of the Georgia Breastfeeding Coalition, what we've done and others have done to help businesses comply with the law or those who want to voluntarily ensure that they're meeting the needs of their employees. And I hope that this will be an inspiration to some of you who are working with breastfeeding mothers and their babies that need those accommodations. The business case for breastfeeding was designed to help businesses see that there's a benefit to the business to comply with the law and accommodate their employees, that it's not only a hit on businesses, but how it benefits the businesses. I'm going to share some of those talking points to help inform the discussions that we're all having in our communities when we advocate for lactation accommodations, either in our communities with businesses or at the Capitol, or when we're helping the employers of our patients and clients to comply with the law. So we will get started with just a review of the health impact of breastfeeding and why breastfeeding is a public health issue. Of course, this is a review for most of you, but breastfeeding is recommended by all the major medical and professional associations. And many of us are familiar with the health impact on infants of breastfeeding and how it mitigates the risk of infection and illnesses. But when we're speaking to employers, it's important to kind of hit on some of these issues from the angle of an employer. So the business case has all these talking points laid out and has associated tidbits like for every 1,000 babies who are not breastfed, there's an excess of 2,000 physician visits, 200 visits, days in the hospital, and 600 prescriptions. So employers that are providing insurance, this is meaningful to them because it's a cost-saving measure to increase or improve the health of their employees' babies. The business case for breastfeeding lays out some specifics around how breastfeeding improves the health of children and how that affects the babies that are enrolled in daycare. And the use of daycare does kind of give us a hint that some of the information in this material is going to be slightly, might need to be adapted to more modern usage. I know 2011 doesn't seem that long ago, but we now would use different phrases rather than daycare. So that's important to keep in mind that although a lot of the points are good, we would want to adapt some of this when you're using it to present to businesses. But attendance is associated with double the odds of needing antibiotic therapy, but breastfed infants who are breastfed for at least 4 months significantly decrease the odds of them getting otitis media. And I'm talking about the protective effect of breastfeeding, especially for children who are in group child care situations. Okay, so focusing some of your talking points onto how breastfeeding makes good business sense for a business can start with lower absenteeism rates. And for example, one-day absences to care for sick children in employees occurs more than twice as often for mothers of infants that are exclusively formula fed. And there's references for all of these talking points in the kit and also at the end of my talk. I'm happy to provide them. And that's the kind of like hard data that speaks to employers. Another example is lower healthcare costs for the employer. And there were some studies. Cigna, which is a big health insurance company, did a study, a 2-year study of 343 employees that reported an annual savings of $240,000. That's almost $250,000 in healthcare expenses. They also had 62% fewer prescriptions and $60,000 that they saved in reduced absenteeism rates. Another talking point is to review what the kind of bottom line benefits are for an employer who is providing good accommodation for their employees to breastfeed or to express milk when they return to work. And one of those is lower turnover rates. When Mutual of Omaha did a study, their lactation support program that they implemented resulted in a retention rate of 83% of female employees compared to their national average of 59%. And that can be very meaningful to employers that employ a lot of women of childbearing age. And we're going to talk a little bit about a study of that. Another study of multiple companies with lactation support programs found an average retention rate of 94%. And what that means to an employer, a business owner, is that all the resources they've put into training employees is preserved rather than wasted when that employee may not choose to come back to work after they have a baby. Retention rate is something that may not be so meaningful to those of us who are not necessarily business owners, but it's very meaningful to those who have put a lot of resources into training their employees. We talked a little bit about this slide already. I think I went backwards by accident. Hold on. healthcare costs, lower turnover rates. I'm feeling like all my slides are not here. So I will, it looks like all my slides didn't get loaded. So I will just speak from here and see if our friends at Healthy Mothers, Healthy Babies can find where the rest of, maybe they didn't all upload. The other benefits to employees are higher employee productivity and morale, and higher employer loyalty, which is important to retention as well. And recognition as a family-friendly business is important. Some businesses really like to promote themselves as a family-friendly business. So that's an important benefit that we can talk up to employers when we're speaking with them. Next, I have an example here in Georgia. Our advocates from the Northwest Georgia Breastfeeding Coalition, including the WIC breastfeeding coordinator in that area, Carol Hendricks. She's a past GBC president, and she spent some time working with a lot of the carpet mills in the area in Northwest Georgia, where she was working, and some of her colleagues in public health and with the other coalition members worked with some businesses there that employ a lot of women of childbearing age. And one of those was Shaw Industries, and they employ over 1,000 employees, and about 40% of them were female, and of that 40%, 70% were of childbearing age. And they started the conversation by communicating with human resources and their occupational health nurse. And they ended up converting an empty office into lactation rooms. And then they were able to get a multi-user pump available, and the health nurse would issue breast pump kits to employees when they came back from maternity leave. And then they made sure to communicate with all their employees about the lactation room being available. Another part of that was working with the line managers to set up breaks, how they could relieve, have a system in place to have somebody to relieve the mothers who needed to take lactation breaks. And this program has continued and also has influenced other large companies in that area, such as Engineered Floors, which has multiple lactation rooms. And it's really a great example of how community leaders can work together with mothers and employers regarding the business case for breastfeeding. And by community leaders, I don't mean the mayor necessarily. I mean you and I that are out doing the work supporting breastfeeding mothers in their communities. So I have a picture of their lactation room, and hopefully we can get these slides out to you. I apologize for that we're having a technical issue where all the slides didn't get uploaded. I wanted to show you all that the business case for breastfeeding materials are all available on the Office of Women's Health, which is womenshealth.gov. If you go to their breastfeeding section, you can go to breastfeeding at home, at work, and in public, and it will give you all these resources online and PDFs as well. But I do have copies of the toolkit available for any of you who request them, and I'll keep sending them out until I don't have any left. And then the PDFs are still available once we've given out all the hard copies that we have. The Breastfeeding Coalition website, like I mentioned, is georgiabreastfeedingcoalition.org. And we're in the process. We have a brand new website up, and we're adding links and resources regularly. So visit often. And like I said, if you scroll down on the main page, you can sign up for our mailing list. And if you go to the contact tab, you can email us to request a toolkit for me to mail to you. Our coalition was also involved in creating videos that are available to view and to share with employers in each of the industries. Every business is categorized into an industry, and so under the Supporting Nursing Moms at Work section of the Office of Women's Health website, there's videos about what the law says, what employers need to know, break time, which Sarah's going to go over in more detail, but we'll have a link on the website to for you all to review the videos. We helped facilitate the videos for the manufacturing industry, and you can see some of what I was telling you all about the carpet mills in person on the videos. And we also helped with several other of the industries that are filmed right here in Georgia. So it's really fun to be able to share those and say, here's an example of how managers of businesses right here in Georgia are accommodating breastfeeding mothers to have break time and space at work, and how it has benefited their business. It really puts that business leader right there in the room with you to show that, or send a link to those videos when you're working with an employer in your area. So we have links to all that at our website. And we are happy to be a resource to any of you who are working with employers or employees in your area to help kind of strategize about what solutions might work for an individual business in terms of space and time. And we hope that you all will get in touch with us if you're working in your area to improve access to accommodations for mothers when they're back at work, and we look forward to supporting you with all of that. We'll have hopefully time at the end for some questions and answers, but for right now, I will pass it back over to Sarah.
Thanks so much, Claire. That was so great. And I just have to say before I get started, I'll be focusing on kind of the laws that are at play, but laws are only as good as how well they're implemented and the policies that employers put in place. And so, Claire, your presentation just reinforces how much, community level work and really working on the ground with employers and helping facilitate to make sure things run smoothly is really what's needed. So thank you. Just to introduce myself, I am Sarah Brafman. I am an attorney and senior policy counsel at A Better Balance. For those of you who may not be familiar with A Better Balance, we are a national legal advocacy organization. We are based in Nashville, New York City, and now in Washington, D.C. And what we work on is advancing the rights of pregnant, breastfeeding, and caregiving workers. We do that through various strategies. We work on passing legislation and policies. We work on strategic litigation. We run a free legal helpline where any worker can call us with questions and we can provide information. So I have provided that at the end of these slides, and I'm sure Healthy Moms, Healthy Babies can send that out as well. But anyone can call us. It's free, it's confidential, and we really just want to be able to provide workers with as much support as possible. So what we're going to cover today on my end are various laws that hopefully are helpful to the women that you serve. And we're going to focus first on the federal law, as well as an update that we're hoping will pass in Congress to strengthen the federal law. So many who have joined us might be familiar with a federal law that passed along with the Affordable Care Act, that is the Break Time for Nursing Mothers law. And what that law does is to amend something called the Fair Labor Standards Act, and it requires employers to provide reasonable break time for an employee to express breast milk for her nursing child for 1 year after the child's birth, each time such employee has the need. So if someone needs to express milk for up to 1 year, the federal law covers that. Who it covers is something that we will discuss in further detail as to why that needs fixing, but it applies to employers and employees covered under the Fair Labor Standards Act. The Fair Labor Standards Act is most commonly known as the wage and overtime law. But what that means is that when the law was written for nursing mothers, all those who were exempt from FLISA, meaning employees that don't receive overtime, also weren't covered by this law. So it wasn't that all of these workers were intentionally exempt at the time, but the consequence has been that you have a lot of workers that aren't covered. And we'll go into more detail about the kinds of workers that aren't covered. So assuming that an employer is covered, what they have to do is provide unpaid break time for an employee to express milk. It has to be a clean private space that's not a bathroom where workers can pump without interruption. The one caveat about the break time being unpaid is that they don't need to be paid unless the worker is taking the time concurrent with their paid break. So if someone is using the time as part of their already instituted paid break time, then they would need to be paid for that time. So that is generally the federal law. But just to dive again into a little bit more detail, employers are required to provide a place other than a bathroom that is shielded from view and free from intrusion from coworkers and the public, which may be used to express breast milk. Now, I think as most on this call know, that doesn't mean that you have to construct a lactation space, dedicated lactation space, but that it has to be something that is private and a coworker couldn't just simply come in and use that space easily. The other thing to remember about the break time for nursing mothers law, and this is really a point that I think folks get a little bit confused about, is that it currently covers employers of all sizes. So there is no minimum threshold where employers with 15 or more, or 15 or fewer rather, don't have to abide by the law. That's not the case. Employers of all sizes are covered under the law. The one caveat is that if an employer has fewer than 50 employees and would have significant difficulty complying with the law, based on the size of the employer, their financial resources, then it's possible that they can be exempt from the law. So I think that's just something to reiterate, is that employers of all sizes are covered, but employers with 50 or fewer can claim this hardship exemption. But what that's also important to know is that employers with 50 or more cannot claim a hardship exemption. So they have to abide by this law. So that's just one key factor that I think is important to reiterate, because there's always some confusion with some people thinking, well, employers with 50 or fewer are actually just exempt. No, they're not exempt. They can just potentially claim a hardship exemption. Again, with the paid breaks, then an employee must be allowed to use that paid time to pump milk if they're expressing milk during their paid breaks. It's important to remember there's an anti-retaliation provision of the law. So an employer can't retaliate against someone because they are using this break time. And we do hear from callers who call us saying, they're not putting me on shifts, they're cutting my hours because I need to pump. So if that's the case, please call us because that absolutely is against the law, assuming that the person is protected. And I should say, I am an attorney. I am barred in New York State, so I am not an attorney in Georgia. So nothing that I share on this call should be considered legal advice. I'm not anyone's attorney on this call because I am barred in New York. Just to reiterate, if you know someone who's having trouble, who's not getting the type of accommodations they need, please have them call us. The number here is our Nashville office. There'll be another number that I can provide at the end. That's our general hotline. And then if someone is in Georgia, they will get routed to our southern office. And then the Department of Labor also takes on complaints. We'll get to a little bit about enforcement of this law and problems with enforcement of this law, but the DOL is the enforcing agency of this law. All right, so I am going to highlight the problems with this law, and then I'm going to highlight a bill that's now in Congress to update the law, called shorthand is called the Pump Act. But I do want to reiterate that the current law is powerful. For those who are covered, it has changed the landscape, and you know, folks have rights under it and should utilize those rights. So I don't want my highlighting the problems with the law to make folks think that it's not a powerful law, but there are problems with it, and we are trying to update it. So the first big problem, like I mentioned, is the gap in coverage. And because of the way the Fair Labor Standards Act defines an employee, that leaves 9 million working women of childbearing age not covered under the law, because that number of workers is excluded from overtime. It's about 1 in 4, and it includes workers like administrative, executive, and professional employees, which is managers, and includes managers and teachers. It includes airline and railway workers. It includes agricultural laborers and lots of other employees who are, you know, exempt from overtime. So that is a very big gap, and it is one that we very much want to close. The second big problem are the enforcement challenges. So the problem with the current law is that the only type of remedy a person can get if their rights are violated are unpaid wages. But the problem with the failure to provide space and time is that it doesn't always result in someone losing wages. And in order to really have a case, there has to be an available remedy for you, right? Otherwise, a court won't take on that case if there's actually no available remedy to redress that person. So this leaves most women without any meaningful way to enforce their rights or to address the negative health consequences or the financial harms, right? It's mostly, you know, women are suffering if they get infections, or they have to terminate breastfeeding, or they have to go out onto unpaid leave, or if there's job loss, then it's really been the case that most cases have been thrown out, and you'll see very little enforcement of this law for that reason. So those have been the top 2 challenges of this law. And that's where the Pump for Nursing Mothers Act comes in. We're calling it the Pump Act for short. And it strengthens the federal break time law in 3 really important ways. The first is around the coverage gap. So the current bill would close that coverage gap and would extend protections to salaried employees and all other categories of employees that are currently exempt from the protections. So that's the huge first piece of what it would do. Another piece of what it would do, and skipping to the third bullet, is provide much real remedies for workers. And these are remedies that are actually available for other violations of the Fair Labor Standards Act. So it's really bringing the remedies into alignment. It's not the case that what the bill would do is provide breastfeeding workers with more remedies than other workers covered under FLISA, but it's really just bringing it into alignment. And then the third piece of what it would do is provide more clarity around when workers have to be paid and when they don't have to be paid. So what the bill does is leave in place existing protections that many salaried workers have, which is that they can't have their pay docked. So that's very important. If a salaried employee is using break time, their wages can't be cut. And it also clarifies that employers have to pay an hourly employee for any time spent pumping if the employee is also working. So that's something we see often, where someone is not really using their break time as a break, they're still working while they're pumping. So if it's the case that someone is still working while they're pumping, then they should be paid for working while they're pumping. It's not technically a break. So the bill would clarify that as well. It is a bipartisan bill. It has been introduced both in the Senate and in the House. Senator Murkowski and Senator Merkley are the leads in the Senate, and Congresswoman Maloney and Congresswoman Herrera Butler are leads on it in the House. So far, it has gone to a hearing in the House. So the head of the United States Breastfeeding Committee testified at a maternal health hearing and spoke on the bill. So that's the current status of the bill, but we're very much hoping that it'll move swiftly in this Congress so that we can shore up the federal break time law. Now, the other law that is important under federal law is the Pregnancy Discrimination Act. So the pregnant, and we'll get to why the Pregnancy Discrimination Act also involves breastfeeding. So the Pregnancy Discrimination Act passed in 1978. I'll call it the PDA for short. It's a federal law that prohibits discrimination or unfair treatment based on pregnancy, childbirth, or related medical conditions. If an employee works for a private employer with 15 or more, then they're covered under the law. So this law does have a minimum threshold, not unlike the Fair Labor Standards Act, which has no thresholds. The PDA does have thresholds of 15 or more. It can be used for protections beyond pregnancy, which includes breastfeeding. And what it really means is that you can't discriminate based on the terms or conditions of employment. And so if an employer is providing, for instance, breaks to someone else or accommodations to someone else, then they would have to provide those accommodations to a pregnant worker as well. Now, when it comes to related medical conditions, the law does protect against discrimination based on medical conditions. Now, for many years, there were courts that were saying, well, pregnancy-related conditions doesn't include breastfeeding. Kind of mind-boggling that that would be the case, that breastfeeding wasn't a pregnancy-related condition, but fortunately, current courts pretty much across the board are recognizing that the law covers breastfeeding and that breastfeeding is a related medical condition. So that's another one where an employee can't be discriminated against for breastfeeding. And if they're providing accommodations for other workers, if someone's allowed to take 15-minute cigarette breaks, but they're not letting someone take breaks to pump, then that is potentially a problem under the Pregnancy Discrimination Act as well. Now, another growing policy trend that's helpful to breastfeeding workers are something called the Pregnant Workers Fairness Acts. So 28 states, although unfortunately not yet Georgia, though Healthy Mothers, Healthy Babies is helping lead a coalition to help pass this measure, have stronger protections for workers with limitations related to pregnancy, childbirth, or related medical conditions and are in need of workplace accommodations. And so that really means when workers are provided pregnancy accommodations, it means that what we're often seeing is if they're not provided accommodations, then often they can be forced out onto leave, which means that a worker is exhausting their leave before they even give birth, which thereby affects the ability to maintain and start breastfeeding if they have to return to work fairly immediately. So the more that someone has the time to take for leave, the more they can start having a good breastfeeding practice and promoting breastfeeding and increasing the rates of breastfeeding. So that's one other trend. And then the last piece that I wanted to focus on is Georgia law specifically. So one thing to note is that Georgia is one of only a very few number of states that don't have anti-discrimination protections based on sex. I should have mentioned the Pregnancy Discrimination Act, defines pregnancy discrimination as a form of sex discrimination. So again, in Georgia, there is no sex discrimination and there is no specific ban on pregnancy discrimination. However, federal law still applies. So if someone's facing discrimination, they may still have a claim under federal law. Georgia does have a statute in place for breastfeeding workers, but it is permissive. It's not a requirement. So the law as it currently stands says employers are allowed to provide reasonable unpaid break time in an area other than a toilet stall, but it does not say that an employer is required to do that. Atlanta does have an anti-discrimination ordinance, so it is important if someone is facing discrimination in Atlanta, then they may have both protections under federal law and under Atlanta law. The last piece, I don't know why the slides sort of skipped ahead, but the last piece I just wanted to cover were two bills that are moving in Georgia, which are I think it's SB 327 and HB 1090, I believe. Okay, yes, that's right. So thank you for moving back to the slides. So S 327 is a bill that would changed the Georgia statute from being permissive to being a requirement. So it says, an employer shall provide that time. And it also includes enforcement, because right now the law has no enforcement, which basically, means that workers, it's employers are not being held to account to provide this, not to mention that it's also permissive. So that bill is really the stronger bill. It's really the one that we would want to see pass through, because it adds both a requirement. It's also, the bill is a little bit more detailed in what it provides, and again ensures enforcement, which is really crucial for these measures. HB 1090 does add in the requirements, which would change it from the law from being permissive to a requirement, but still makes clear that the law can't be enforced, so is inferior to Bill 327. And just moving to the last slides, I just want to reiterate that we do have a free confidential legal helpline. If folks need to call us, if you have questions as a provider, or if you have a patient or client that has questions, please let us know. We also have a resource called Talking to Your Boss About Your Pump. They're state specific, so we have a Georgia specific one. These are a resource that we developed with the Center for Work-Life Law, and it's really meant to be worker friendly, and helping to navigate the process of asking for the accommodation, working with your employer, trying to set up the space, but also giving details about the law itself. So it is a guide to help workers through, and you can find that on A Better Balance's website at abetterbalance.org. And we have other resources on breastfeeding as well, along with information about our free confidential legal helpline. And now I'll turn it over to Mika.
Awesome. Thank you so much, Sarah and Claire. And we will certainly get the slides out to you. All the slides will be available in that follow-up email that you'll receive with the survey. So sorry about that. I'm not sure why some of them were cut off. So if you have any questions at this point, you can put them in the chat box and I will answer them as they come through, or I will have our presenters answer them rather as they come through. So I will give you a few moments to do that. And then I see a few people have their hands raised. That's fine too. I can unmute you and you can also just say your answer directly to, or your question directly to our presenters. So Linda, I'm going to unmute you. Linda, you are free to ask your question now. Are you still there?
I didn't have a question.
Oh, okay. It shows that your hand was raised, so.
Oh, I'm sorry.
Okay. No problem. Let's see. Y'all bear with me for just a second as I pull it back up here. Right. Well, while folks are still putting their questions in queue or raising their hands, is there anything that for both presenters that you all would encourage our attendees to do, just from an advocacy standpoint, to ensure that mothers have access to workplace breastfeeding accommodations at work? I know you mentioned a few things in the presentation, but if you kind of had one last thing to share that they could be doing now or implement, whether that's within their practices or from an advocacy standpoint, what would you suggest?
This is Sarah. I'll jump in terms of advocacy. I think, the Pump Act is moving in Congress. So to the extent that your organizations can sign on. The United States Breastfeeding Committee has an organizational sign-on letter, or you want to encourage your representatives to support the bill, that would be great. And then I think, knowledge is power. So to the extent that you can educate those who you're working with about these laws, I think that this will be circulated and this information will be available, and you all are the best conduit for that information. So the more it can get out there, the better. And as well as our helpline that, we are here. We staff it 5 days a week, and our goal is really just to help workers understand their rights and be able to pump or get the kinds of accommodations that they need. So please feel free to see A Better Balance as a resource for that.
Awesome. Thanks,
Yeah,
Sarah.
this is Claire. The Georgia Breastfeeding Coalition signed on with the USBC, and if any of you represent an organization, I think they're still accepting organizations to sign on to the letter supporting the PUMP Act. And there's information about, how to contact your representatives. It's all at usbreastfeeding.org. And the U.S. Breastfeeding Committee is sort of a sort of parent or support organization to many state and local and tribal breastfeeding coalitions and other organizations that come together to work on these types of issues.
Awesome. Thank you. So we have a question from Margaret. Hi, Margaret. The carpet company example was interesting. Wondering if any of the other research on cost savings had any particular examples of cost savings / retention for hourly workers and low wage workers in those environments, perhaps reducing, sorry, I'm trying to open the rest of your question. Perhaps reducing turnover is less motivating.
Yeah, I think it's important to consider the business when you're, which angles about the business case would be the most motivating to them. And I would refer you to the videos under the different industries that are, and information for the different industries to kind of help if you're not a business person, and many of us on the call are healthcare providers or community health workers, and we're not necessarily thinking in that mindset. So the Supporting Nursing Moms at Work website can really help give that kind of help you put yourself in the mindset of a manager of one of those different kind of industries. So I think you're right. I gave that as one example since it's one of our more successful efforts here in Georgia, and it's affected a lot of workers because it's a big industry, but even helping one person is worth your time. So I think it's important to put yourself in the mindset of the employer when you are presenting it from the angle of a business case for breastfeeding. So I think you're right that retention isn't always going to be the main angle. So looking at what would be the most kind of beneficial to them, besides the obvious, like we should all in our society be doing more to support, we're all in that mindset of like, of course we want to do things to support new mothers to breastfeed, but from an employer point of view, the different industry videos and resources can be really helpful.
Great. All right. Well, we don't have any other questions in queue right now. I think if anything certainly comes up afterwards, I can forward to the presenters, or their contact is listed there. I know Sarah's is, and you can go back further up in the slide.
Yeah, a hot tip, if you hit contact us on the Georgia Breastfeeding Coalition website, that comes straight to me right now. So that's an easy way to reach me. But you can also reach me at georgiabreastfeedingcoalition@gmail.com, or catch me here at the Georgia AAP. My office number is 404-881-5095. I'd be happy to strategize with any of you.
Awesome. And if you are interested in some of the breastfeeding work that Healthy Mothers, Healthy Babies is supporting, You can go back to our website, which is hmhbga.org, and if you want to join that newsletter, we send out a weekly Keeping Current at the Capitol, so you'll see all of those breastfeeding legislation that Sarah had mentioned as well. Oh, we have one other question. Perfect. Lillian says, where are we in legislative process with SB 327?
This is Claire. It's crossover day tomorrow, so if neither of those bills gets out of their respective chambers, then they won't be passed this year. That's my understanding. Mika, what would you say?
Yep. So we're definitely keeping an eye on crossover. And Lillian, like I said, if you want to join that newsletter, you'll get the weekly updates on that. So certainly next week we would include whether or not that made it over.
Mm-hmm. And there's a possibility, that the two could be like combined or amended to like kind of hit different angles. The today and tomorrow is when a lot of things happen because they're which bills quote cross over to the other house are the bills that are either like alive for this session still or not. So the next couple of days are important. It wouldn't hurt to reach out to your Georgia senator or representative, and you can. It's really easy to find that information. You can either go to the Georgia General Assembly websites and search, or you can go to just Google, how do I find my state representative or my state senator? And there's several websites where you can find those. And it wouldn't hurt to be general and reach out to your state senator or state representative and say, please support accommodations for working mothers. And if you're going to do that, do it today so that it gets to them while these are in front of them.
There's a website, openstates.org.
Mm-hmm.
You can go on there and put your address in, and it'll show you who your representatives are.
Yeah, and some people prefer to email, and some people prefer to call and leave a message or talk to a staffer. It helps to reach out to your own person, your own representative or senator as a constituent, because they pay the most attention to their own constituents.
Great. Well, thank you again, first to our presenters for taking the time to do this. Thank you both so much. The information was great, and we just appreciate you taking the time out to do it. And thank you all for attending. And as I mentioned previously, you'll receive an email from myself, Micah, or either from one of our program associates, Ashara. So you can be on the lookout for that. Within a few days, that will have a link to the survey for the webinar, as well as the presentation. And like I said, I'll make sure it will include any of those missing slides, as well as a link to the recording. So lots will be in that email. And then once you complete that, the survey, and if you're looking for certs, there will also be a post test. Then give us about a week to email you your certificate. So thanks again. And if you have any follow-up questions, either for our presenters or for someone at Healthy Mothers, Healthy Babies specifically, please feel free to reach out and we will be sure to connect you. So have a great afternoon, and thanks again for joining us.
Thank you.
Thank you so much.
All right.